This video is not really a happy one. I said I'm moving away from scripted videos, and this isn't scripted. It's kind of like reactionary. And I'm not always the most vocal person about this stuff, but I thought it's important to share. You may have heard in the news or on social media of, and please, I apologize if I'm saying this wrong, but I believe it's Jing Mai. Dr. Jing Mai was an intern, resident physician who took her own life this past week, I believe. And it really leaves you speechless. I'm in the third year of my training. I can see the light. It's kind of close to the end. Whatever your feelings are about training or getting through it, I'm close to getting a job and being able to pay loans and having some freedom back. That's not the case intern year. You're nowhere near that. You're hundreds of thousands of dollars in debt, and there's really no end in sight. And you start going to work and you feel bad at your job. And, maybe you're in an environment where people aren't supportive. And that's really scary and sad to think about, because I know that there are hundreds, if not thousands, of more residents across the country that probably feel in a similar place. In fact, there's lots of studies that show that both medical students and residents suffer at a way higher rate from anxiety, depression, and actually suicidal thoughts compared to the general public. Compared to almost any other profession. It's not okay. It's not okay, and I get real sad about the healthcare system, and I don't know what the answer is to this, because I just don't see it changing. And this is not to doom and gloom or make this big sad video, but I don't know what you do to fix this. And I'm curious what anyone else thinks or has felt down below. This isn't necessarily a video to share my feelings or thoughts on residency, but more I just am kind of curious to stimulate the discussion of what can be done differently. Because let me break down what a resident goes through in a week. The average resident is doing somewhere between 60 to 80 hours a week. There are programs where you're doing more than that, and there are actually weeks where you're doing more than that, because it's a rolling average, so you don't actually have to meet that requirement. And if you think of the average job being 38 to 40 hours a week for most people, they're getting lunch breaks, they're getting whatever the breaks are in their state. You don't get breaks as a resident. I'm sure somewhere someone says you do, but I'll just tell you don't. Attendings, at least in my field, are pretty understanding. If you want to go to the restroom, you want to step away for 10 minutes to eat, they'll accommodate that, but it's not the norm to get a scheduled break, at least in my experiences. There's also call shifts, which still exist, which can be 28 hours long if you actually go home on time. And you can imagine that you're essentially just working in the hospital the whole time. And it's not really complaining about working, but you can't get your other life activities done. For example, I have this weird freckle right here. Now, maybe it's absolutely nothing, or maybe it's precancerous or cancerous. I'm not a dermatologist, and as we continue to specialize our knowledge in medicine, there are certain skill sets that we lose out on, and I would love to see a dermatologist. In fact, I just made an appointment because I've taken some of the things in the last week to heart and realized you got to take care of yourself. I've known that I need to see a dermatologist, and it's hard to book an appointment months in advance when you don't have your schedule months in advance. It's hard to want to give up a day off to go sit in a waiting room to go see a dermatologist to get this taken care of when that's your singular day off in a week. Thankfully, as an elective, I'm choosing to go get it taken care of, but what if I had a real active medical problem that I need to go seek help for? It's difficult to accommodate those things. It's difficult on a simple scale to get groceries every week, to clean your apartment, to wash your clothes. With that many hours, it's difficult to do those. It's hard to take care of yourself. It's hard to make time to go to the gym. I I think all of that's probably obvious when you look at the hours. You know, and then there's this whole component of you should show up and be 100% for your patients. I don't know what person is 100% of a person when they're spending 80 hours at their job and have to do life outside of that, most of the time on their own, with no one here. Cleaning, cooking, food, wellness like the gym, whatever else. That's a lot. And to do that for 3 years or 4 years or 7 years is a lot. So I don't know how we fix that. You know what to do in the comments. Let's start a discussion because I'm curious and absolutely heartbroken over the loss of life last week. This is a very difficult process going through training, and it's so much harder than med school in ways that you don't know until you're here. So next time you see a resident, ask them how they're doing and do something nice for them because it will mean a lot. And the system needs to change. I don't think it's going to work this way for a long time. I think with everything that's going on and increasing demands, I think that you're going to see less and less people wanting to do this. And it's not getting any easier. So I don't know. Just thoughts. Curious what you think. Let me know down below. Thanks for watching. Again, not the most positive video, but I think we need to talk about these things. We'll see you in the next one.